9 minutes after 11 o'clock. Thank you for tuning in. Our guest this segment is Stephanie Pollard. She's a community health educator, and we're going to talk about your health, and I think specifically men's health. We're going to find out from Stephanie if we got it right or not. And usually during this segment we have our guests on the phone, but she came into the studio, drove all the way down from Gainesville to be with us. So good morning, Stephanie.
Good morning.
Thank you for coming in. Did I say your name correctly, your last name?
Pollard, that's correct.
Pollard, excellent. Now, next to your name, Robin wrote MPH.
Yes.
Now, is that how fast you drove down here?
No, that's Masters of Public Health.
Oh, Masters of Public Health. Okay,
yes,
I hadn't seen that one.
From the University of Florida in 2004.
All right.
And I've been a long-time profession as a laboratory technologist, and adding the MPH to my current career was a good thing, that I could do more things in the community.
Oh, excellent. And what agency are you with, or are you with one?
Well, I have my own small business. It's called Health Workshops Are Us.
Okay.
And that allows me to go and do community events, go to speaking engagements. I just come back from St. Croix, Virgin Islands. I was on a TV show there.
Oh, wow. Well, good for you. Did you have to speak with an accent?
Well, after you've been there, I was there for a week, so after you're there a couple of days, you kind of almost pick it up.
And what is it, like a Jamaican accent?
Yeah, it's an Islander accent. Yeah,
I think I could do that.
Yeah,
I can handle that.
Okay, can you do it now?
Irimon, is that good? Irimon? I don't even know. Okay, so now I have on my notes that we're going to talk about men's health.
Yeah.
Is that what you specialize in?
Well, we're coming up to. I guess it's two things. It's Prostate Cancer Awareness Month is in September, and so we're gearing up for that. We're going to have a big Men's Health Expo / Health Fair.
Does the word big modify the word big men's?
It's all women's dreams. Let me tell you.
So the word big modifies the word health.
Yeah. Well, historically, it's a little bit more challenging to get men to come out to health activities. You know, if we have something sports related, I mean, the men come out and
so what is the idea here?
The idea here is that we have an increased rise in prostate cancer, and so we really want our men to be more proactive and going and getting the annual physicals. And that's been my push about annual physicals, because at annual physical you can get all your checks done, get all your screenings done, get your blood work done, and you can catch things at a very early stage before it gets to the aggressive treatment stage.
Right.
And that's what my goal is prevention and awareness.
So let's talk about the two extremes. Let's talk about the worst one first, the aggressive treatment.
Yeah.
A doctor gives you a test and he says you need aggressive treatment. What does that mean?
Well, most likely that's surgical. And if it's pertaining to cancer, it's usually surgery and some type of chemotherapy and radiation, or all three.
And what about the other extreme? A doctor checks you and says, "Oh, you got a little touch or something." What
and they usually do a biopsy, check it, see if it's got cancer or not. If it does, then a lot of times with that biopsy, they can usually get all of it with a biopsy. And a biopsy, you can do that in the doctor's office. That gives you the extreme. One treatment you can do in the doctor's office, you can usually go home. The other treatment, you're in the hospital, surgery, and you're going to have some treatments afterwards, which is a more long-term and much more expensive option.
Right.
When you have the Men's Health Expo, do you have experts from all of the fields that pertain to men's health, and then men can come in and ask their questions and have their comments heard?
Yes, it's going to be on September the 11th at the Martin Luther King Center in Gainesville.
Okay.
And it's going to start at 9 a.m. to 2 p.m. We have they call it the mobile clinic. And it's like it's similar to a blood mobile, but they're able to do exams in there. So they're going to be doing the prostate exam screenings and also blood tests. Then we're going to also have blood pressures. We're going to have speakers that's going to come and talk like first thing on prostate cancer and talk to the men about it. And then we're going to have a variety of health issues that's related to men.
And is this all at no charge?
No charge.
Oh, that's
No
wonderful.
charge. And we're going to have some people that are coming, because we have some in the rural communities. So we're trying to coordinate like bus or van, bringing people in, because a lot of times our smaller communities don't have access to free stuff. They might have a clinic there, but they don't oftentimes have access to free stuff.
Okay. Well, we're here to help you. We want to get the word out about good things like this. So we'll pay attention to what you're saying now. We'll take notes, and then we will continue making sure the message gets out there from now till then. So tell me the date and the place again.
It's September the 11th.
Okay, that's an easy date to remember.
911. It's going to be at the Gainesville Martin Luther King Center.
And where is that exactly?
That's on Waldo Road.
Waldo Road, okay.
Right off of Waldo Road and 8th Avenue, and I do not have the specific address, but most people know the Martin Luther King Center there.
Right.
It starts at 9 a.m. and it ends at 2 p.m. And at 9, we'll do the check-in and registration, just getting, everybody signed in. And then about 9:30, we'll have a physician that's going to talk on prostate cancer, and then also answer questions. Have a question and answer session.
Oh, why are you so active in the health field?
Well, initially with being a clinical laboratory technologist, I knew I just didn't want to be inside the lab. I knew that like right away. And I'm originally from Jacksonville, and one of the first things I did early on in my career, I used to work with St. Vincent's Hospital, and they had what we called a wellness wagon, similar to a bloodmobile, but we would go out and do cholesterols. We do your we do your lipid, cholesterol, HDL, LDL. We do your glucose, and we do triglycerides. And so it was kind of like having a little mini screening test, and then we would also do blood pressures. And we would go to colleges, we'd go to gyms, we'd go to senior citizens' homes, we'd go to the mall, and then I knew I liked being in the community. So really, community health education started there.
Yeah, right. It sounds like it.
Yeah,
you just had a passion for getting the word out and being one-on-one with people, kind of like you're doing right now with us. And just spreading the word.
Yeah, and we even, when I initially moved to Gainesville in 90, that same company came to Gainesville because we went to St. Mary's, Georgia, and there's an Army base there, and they were having a big health fair for the men. So we brought our wellness wagon there, and we participated and did their screenings, and it was a very good experience. So I actually say in 87, that's when I really started doing community health education.
You bet, that's a long time.
Yeah, and
you don't look old enough to be doing that.
No.
Yeah, this year is my 25th year as being a clinical laboratory technologist. Yeah.
Wow.
Yeah.
So good healthy practices pay off, huh?
Well, I try to, you got to keep it together.
So at the men's health thing that you're doing in September 11th, you want to do something to attract men.
Yes.
Have you thought of pong beer? Have you tried beer pong? What is that thing called? You know, where you bounce the ping pong ball and try to get it into the cup of beer?
Yes.
They're still working on like the activities.
Well, that one would work. That would work. That would help. Yeah.
We're trying to get. There's a prostate cancer foundation, and there's a musician. He's an R&B musician back in the 60s and 70s, Charlie Wilson. So we're trying to see if we can get him to.
No, it's not going to work. It's not going to work. No. Let me help you out here. No, no. He might be a very good musician, but he's not going to get the men to come in.
Oh, okay.
No. Who does she need to come in?
Wayne House girls.
That would work. I think that would work. I was trying to think in the lines of a singer.
Oh, yeah. I see.
A lady singer. I don't know who's singing. Who's popular right now? Beyonce? Yeah, Beyonce.
Yeah.
Yeah. And then the men will show up.
Yeah.
Yeah, we'll get all of them coming.
When you go and
I'll have my prostate checked for her.
When you go and do your talks and things and your presentations at men's clubs, how do you keep them from being uncomfortable talking about this? Because this is